There have been some comments that we have reduced the testing of migrant workers, leading to a drop in the number of COVID-19 confirmed cases. Let me say that this is not true. Our testing capacity for migrant workers is about 3,000 a day. We have not reduced it. Instead, we have been increasing the capacity of testing of our migrant workers. The rate of testing has not slowed down. A total of 21,000 migrant workers living in dormitories have been tested since the start of the outbreak. This means that 1 in 15 migrant workers in dormitories have been tested. This is far higher than the testing rates seen in other countries like Korea, which is 1 in 90, as well as other countries like US, UK, or even Hong Kong. Let me also put in context, testing serves 3 very important objectives. First, for us to diagnose patients so that we can provide them with appropriate treatment and care. Secondly, for us to carry out contact tracing so that we can limit and control the spread. And third, through testing, we carry out surveillance to allow us to focus on high-risk groups and targeted groups, which I'll explain later. We have started our testing with the dormitories where there were a high number of cases detected, and now we are actively testing the other dormitories as cases emerge, including the factory-converted dormitories. With this testing approach to determine the extent of infection in the dormitories, the case count from the dormitories will depend to a large extent whether there is a high prevalence rate in these dormitories. But every positive test is added to our daily count. Some of the migrant workers continue to work as they are essential workers. Therefore, to reduce the risk of transmission in workplaces and the wider community, we have also prioritized the testing of migrant workers in essential services during this period. We are also actively testing around confirmed cases in these dormitories where new cases are starting to emerge in an effort to isolate cases and contain further transmission to prevent these dormitories to have many clusters evolving. For dormitories where the assessed rate of infection is extremely high, our efforts are focused on isolating those who are symptomatic, even without a confirmed COVID-19 test. This allows us to quickly provide medical care to these patients. At the national level, we have also been steadily building our capacity to conduct tests for COVID-19 over the past few months. Compared to conducting an average of 2,900 cases a test previously, we are now able to conduct more than 8,000 tests per day, and we will continue to expand our capacity. Today, we have already put in place targeted testing for selected groups, for instance, to ensure the essential workers move out of dormitories are free from infection, or for staff of institutions such as nursing homes, where there is close contact with our seniors. We intend to gradually expand testing to a wider pool of essential workers in order to further the continuity of to ensure the continuity of critical functions and services. This is also important as we start to open up after the circuit breaker measures. Testing remains a key prong of our strategy in this war against COVID-19. But what is more important than testing is for everyone to play our part to prevent transmission by observing circuit breaker rules and guidelines.